This video will provide an overview of the Concordia Medication Management Accelerator, an initiative of Concordia University Wisconsin School of Pharmacy and School of Business in partnership with the Alliance for Integrated Medication Management, and made possible by a donation from Mr. Irv Doman of the Doman Companies. Our goal is to inspire innovation in healthcare across Wisconsin by incorporating comprehensive medication management into primary care. Let's begin by talking about what is the CMMA. This is an 18-month initiative that's going to last through the end of 2018 that will bring together communities and many partners and stakeholders to focus on integrating CMM into primary care services across the Wisconsin healthcare system. We're looking forward to a very innovative and unique model that combines business development with learning and action collaboratives with an ultimate outcome of performance stories that will further drive change, incorporating this very important practice into primary care. A few key aspects of this accelerator is business model development and pitches. We'll be focusing on helping organizations make a commitment and identify what kind of model to put this practice into. Teams that participate will have the opportunity then to pitch that to others in a competitive Shark Tank-like format, which will result in the top 10 further participating in our Learning and Action Collaborative, 5 of which will receive monetary awards. After our pitches are complete, we'll proceed to the Learning and Action Collaborative portion, where everyone teaches and everyone learns from each other, using expert coaching from AIM, our partner that has been doing this for over 10 years on a national level, using the Institute for Healthcare Improvement's Rapid Cycle of Improvement model. They will provide coaching on pacing, the implementation science, and really that commitment and accountability that's so important to move things forward. We'll wrap up our Learning and Action Collaborative by developing performance stories that will really share and bring alive to our communities what we've achieved and what kind of impact it's had. And finally, we'll come back full circle to those business model development plans and pitches and update them for further presentation and use for sustainability of the efforts moving forward. For those not familiar with the practice of CMM, let's take a time out and talk about this focus on patient care revolving around appropriate medication use. This is a patient-centered practice that highlights the need for collaboration, communication, and documentation, involving a team of healthcare professionals focused on optimizing a patient's medication regimens. The process involved in CMM starts with collecting information from our patients, collecting information from the rest of the healthcare team, the medical record, to see what is going on with our patients in terms of their medication use. With that information, we can assess for drug therapy problems, those that we have the potential for experiencing or those that a patient is actually experiencing, and identify those problems, whether they be a medication is not indicated for a condition or we are lacking a medication for an indication, whether or not that medication is achieving its goals of therapy from an effectiveness standpoint, whether or not it's safe for the patient, and whether or not it's the most convenient and cost effective for that patient. With the identification of those drug therapy problems, real or potential, we can develop a plan to better achieve drug therapy goals, work with the team and work with the patient to implement those goals and those initiatives, and then come back full circle to follow up and monitor and evaluate to see that our outcomes are realized. From there, we continue moving on with our relationship with the patient to further provide care for them. Come back to the CMMA now and talk about who can participate. Well, there's a whole bunch of stakeholders that can participate in one or two tracks, but let's talk broadly about who can come to the table and who should participate in this initiative. Really, this is anyone in Wisconsin that is a part of any healthcare organization, pharmacists, community service partners, businesses, payers, leaders, members of other health professions that are interested in medication management can all participate in this accelerator. There's one or two tracks that interested parties will fall into, and teams will form up within each track related to an organization or an initiative or collaboration that comes together. Let's talk first about the Service Accelerator track. The Service Accelerator track is for those established organizations already providing care to patients that want to either initiate or expand their comprehensive medication management services. To participate in the Service Accelerator track, teams must include at minimum a pharmacist, a physician, and a quality improvement or organizational leader type person. Certainly additional participants can be on teams and are certainly encouraged, but that is the bare minimum. In addition, we have a Startup Accelerator track. We recognize that comprehensive medication management is going to need a lot of support. And in addition, there may be new businesses interested in providing CMM to patients. One new startup business will receive a monetary award of $20,000, and that business has to be a Wisconsin startup that is providing or supporting CMM. What are our teams going to do once we break out into those two accelerator tracks? Well, this following schematic will walk us through the whole entire 18-month initiative. First of all, we're going to begin with a launch event, May 19th, 2017, at Concordia University, Wisconsin's campus, where people can come together and learn more. The stakeholders are going to convene. We're going to build awareness and talk about the commitments to improve medication use to achieve that triple aim in healthcare. We're also going to provide a venue for people coming together to explore their partnerships for CMM initiatives. Perhaps you're coming with a team that you already know you want to work with, and perhaps you're coming with an idea and an interest and a desire to connect with some others that you can work with. We hope to create an opportunity for partnerships to be explored broadly, no matter how you are coming to the event. Once we launch and complete our launch event, we'll move into one of our cycles between events called our development phase. And here is where teams that are interested in moving on are going to work to design their CMM initiative and their idea, utilize complementary business and CMM development coaching that comes from our School of Business and AIM, and assemble their implementation team and partners to create a pitch, a plan that is going to be looking viable and important for their organization and for our Wisconsin communities. Those plans and those pitches are going to be brought to an event in the fall of 2017 called our Innovation Pitch Event. Here, CMM initiatives from the Service Accelerator track as well as the Startup Accelerator track are going to be proposed, with evaluators awarding recipients and ranking them. In the Service Accelerator track, the top 10 are going to be able to continue on and participate in our Learning in Action collaborative experience, with the top 5 receiving monetary awards. In the Startup Accelerator track, one group is going to have access to $20,000 and venture capitalists who might be interested in their product or their tool or their service that they're providing as a new startup in Wisconsin. Moving forward from this event, this is when our Learning in Action Collaborative starts. Service Accelerator teams are going to start their transformation journey and get ongoing coaching development from the AIM team to support the implementation and the pacing of their CMM initiative. Our Startup Accelerator track is going to launch and begin their work starting up their company with coaching coming from our friends in the School of Business. At a midpoint in the spring 2018, we're going to bring everyone together to teach and to learn at our interim meeting to see where we are at in our breakthroughs. And this will be very important to provide motivation and to learn from each other about what we can do with the remaining time that we have as a part of the accelerator. And we look forward to progress reports and further actions that we can take moving forward. From that meeting moving forward, again, service accelerators will test and refine with monthly coaching and really work on developing performance results for their compelling story that is going to be presented at our very last meeting in the fall of 2018, an all stakeholder celebration where we are going to share performance stories and look forward to these being very inspiring with a lot of evidence that will be used for strategic conversations to further advance comprehensive medication management. We hope this momentum will be used to spark further sustainability and inspire our communities, our elected officials. We hope to get a lot of media coverage with this kind of event and really draw attention to this important practice. Let's talk next steps. Really, if you're viewing this, please share with anyone that's interested. Talk about your potential participation in this. Reach out to us if there's anything that we can do to help you or to address any questions. And please consider coming May 19th, 2017 at Concordia's campus from 10 to 4. This is a free launch event, no obligations, just come and learn some more, and we'll talk about the process moving forward from there, about how you might get involved and how this is all going to work. Lunch is going to be provided. Again, this event is free, as is participation in this event for those that get selected and will participate moving forward. We would appreciate an RSVP from each individual attending the session by May 11th, 2017. You can go to our website, cuw.edu/CMMA. And again, if any questions, please feel free to reach out to us. Email address cmma@cuw.edu. We look forward to seeing you at our launch event, and thank you for viewing.